Good afternoon to everyone and welcome back. So in this, yes, all set. So in this afternoon session, we are going to have an activity first. So in this, like yesterday, you have finalized your research question, hypothesis and objective. So based on that same topic, you have to decide what are the variables, main variables, primary variables and other variables, along with each what will be the what type of variable it is, what will be the scale of measurement for that variable, and what will be the descriptive statistic for that variable, and what sampling method you will use. Sample size, I think tomorrow we have a session on calculating the sample size, but at least sampling method you can decide, and what inferential statistics that will be required for that for those variables that you are going to select. Okay, so I think you already worked on it. Shall we start with presentation or you need some time? Okay, we'll give you 5 minutes, 10 minutes, and then we will start with the activity. Okay, so you decide by this time variables, what is the type of variables, scale of measurement, descriptive statistics, sampling method and inferential test that will be required.
Good afternoon, everyone. My research question is, what is the difference in rate of reoccurrence of MI in patients with high risk factors of CVD taking statins alone and those with statins plus fibrate?
To raise the question of ethicality yesterday. So they have changed to statins only and statins with fibrate. Okay.
My objectives are to determine the efficacy of statins in preventing MI, to determine the efficacy of statins plus fibrates in preventing MI, to determine the rate of reoccurrence of MI in high-risk patients taking statins and
That
fibrates.
will be to estimate the rate of reoccurrence. Okay.
And to compare the efficacy of statins alone and with fibrates in combination.
So what will be your variable?
My variables are property, that will be nominal, and it is a qualitative thing.
Property, what result we get with the property test?
So the strip shows positive or negative.
Positive or negative? It will be either positive or negative. That's it.
Yes. Then ECG changes, that is
So
also
variable property test, then what type of variable and what scale of measure?
the nominal scale, and it's a qualitative.
Scale of measure is lab investigation property.
ECG changes, that is also nominal and qualitative. Lipid profile is interval and quantitative.
We will record the ECG changes. It will be descriptive. Like property with dichotomy. But there are only two results possible. They're positive or negative. There is no third possibility. That is dichotomy.
Third is lipid profile. That is interval.
lipid profile means this. Lipid profile उसमें बहुत सारे टेस्ट आते हैं वो एक तो कुछ बताओ जो
EGF.
हाँ
Triglyceride levels.
सीरम ट्राइग्लिसराइड or it will be like you get the results now what is the level in milligrams per deciliter or something like that. ऐसे आता है ना result.
Yes.
What type of variable?
No, variable will be dependent. Then you will have a number of measurement that to be more precise, you need to continue. LFT will be total bilirubin directly.
That will be like
Yes.
right.
And RFT serum creatinine. Yeah.
What type of
Same sir, ratio and the dependent sampling method is stratified.
for the outcome variable independent variable.
Dependent the
You are
age
looking
and
for
sex.
outcome variable. If you are looking for reoccurrence, so I will confirm the reoccurrence. It's not what.
ECG and property.
What you are looking for. independent variable. It will have an effect on this reoccurrence.
But drugs, which the patient can statins plus fibrates and statins. Yeah, those are the-
Sampling method.
so stratified only those who had previous episodes of MI. Those only will.
Stratified means how will you stratify? Stratification means there has to be strata. What stratified sampling means first you divide into different strata and then randomly set from each strata. What different strata you are having?
The patient having previous episode of MI.
That is one strata.
Yes.
Okay.
And the patient having a family history of MI.
Reoccurrence we are seeing, so all the patients should have at least one attack of MI, na? With family history
So
also.
with family history.
With family history.
Of MI. Yes.
Have one episode and with family history, that is one.
Yes.
One is without family history.
Yes.
So करने की जरूरत है क्या?
So, and the patients having high risk factors, tobacco consumption, alcohol.
That is third strata. I don't think you need stratified sampling method. Where do you want to stratify? All these are risk factor, family history is a risk factor, all these alcohol, tobacco consumption, that is also a risk factor. You want to take all these people, na?
Yes.
You don't have to do, I think, stratified sampling is needed. You will be doing the hospital setting. If in the community, you can do simple random sampling also. On the sample size. Not stratified sampling.
So we thought the patients having previous episode of MI, so it will be.
You are taking all the patients who are having a previous attack of MI. That is your inclusion criteria. Otherwise, तो है ही नहीं उसको आप लेंगे ही नहीं ना यूनिवर्सिटी. But descriptive statistics for all variables that you stored. What will be the descriptive statistics for those? Property, and all. एक वेरिएबल बताओ उसका डिस्क्रिप्टिव स्टैटिस्टिक्स क्या होगा?
Property.
प्रॉपर्टी क्वालिटेटिव है, पॉजिटिव नहीं, उसमें क्या है? सिर्फ फ्रीक्वेंसी और परसेंटेज आएगा.
Qualitative.
हाँ तो
Yes or no.
तो
Qualitative. Qualitative.
डिस्क्रिप्टिव स्टैटिस्टिक्स
Nominal.
वो वेरिएबल हो गया, टाइप ऑफ वेरिएबल. डिस्क्रिप्टिव स्टैटिस्टिक्स it will be frequency and percentage, that's it. That is the descriptive statistics, madam.
Property ले लो. Frequency use करने वाला.
That is, so how many will be positive, how many will be negative in terms of number and percentage. और quantitative के जैसे सीरम बिलिरुबिन है, that will be mean or standard deviation है. Descriptive statistics. Understood?
ECG changes.
Same as qualitative. Frequency and percentage.
And the lipid profile.
Again, quantitative है, continuous variable है. So again, mean and standard deviation.
And the serum create and bilirubin level same mean and standard deviation. So my sample size was 50.
Yes, tomorrow we are having the lecture, so again you have to calculate the sample size. Okay, Anand Sashi, he will be taking the lecture on how to calculate the sample size. So after that, you calculate the sample. On what basis you are taking? What is the basis? Why 50?
Yeah, so always given
ऐसे नहीं होता है 50, 30, minimum 30.
the rigorous the rate and basis of previously having MI is less.
Less.
25%.
हाँ?
25%.
25%. 25% लेस हो गया. ऐसे नहीं होता है कि एग्जैक्ट फिगर देना होता है. बेस्ड ऑन दैट यू हैव टू कैलकुलेट द एग्जैक्ट मिनिमम रिक्वायर्ड सैंपल साइज. जैसे 30, रिमेंबर आप मोस्ट ऑफ द पीपल थिंक दैट 30 इज द मिनिमम सैंपल साइज रिक्वायर्ड फॉर एनी स्टडी. तो 30 ले लो, बात खत्म. You have to give the explanation why you have taken that particular sample. So tomorrow we are having the lecture. So based on that, you have to calculate the sample size for the student. Okay. Okay, who is the next group? Yes, group D. Start. We don't have time.
Good afternoon, everyone. My research question will be: are there any cardiovascular changes in CKD patient according to the state of the? Are there any cardiovascular changes? And objective is to determine cardiovascular changes in CKD patients, ECG changes, serum electrolyte, and if ECG changes as per the ECG changes is indicated, then only 2D will be advised to those patients.
Variable.
Variables will be
One factor.
input variables, serum creatinine and GFR.
One at a time, then variable, what type of variable, what is the scale of measure?
Serum creatinine for determining the stage of the disease. Then ECG changes.
No, about serum creatinine, then what type of variable is?
Serum creatinine will be quantitative and continuous. And ECG changes, qualitative and normative. These are all detected data. Of the disease will be an independent data.
Variables done. How many variables?
Will be according to the stage of the disease, like in 15 years.
For each variable, so you are going to like summarize that statistic, serum creatinine. So it will be described as mean and standard deviation. Likewise, what are the other variables that you have? What statistics that you will apply for that variable?
Good afternoon, everyone. The question for this group is, what is the difference between sedation and analgesic effects of two different proportions of ketamine and propofol combinations in patients undergoing a short gynae procedure in the tertiary care hospital? Starting with the primary objective. Primary objective is to determine and evaluate effectiveness of the drug regimen of ketamine and propofol in combination of 1:4 and 1:2 with respect to the quality of the sedation and analgesic effect intraoperatively. Secondary objectives are compare hemodynamic variations between both the groups and time taken for the administration of the first dose bolus. Starting with the variables, primary variables are the depth of sedation, which is assessed by the Ramsey sedation scale, which is come under the ordinal scale, and the secondary and one more is the movement of the lower limbs during the surgery. This is assessed by the modified Allred score scale, which is also a ordinal. And these ordinals are the frequency, percentage, come under the frequency and percent. The secondary parameters are the system, SPP, systolic blood pressure, diastolic blood pressure, mean arterial pressure, heart rate, respiratory rate, and SpO2. These are all continuous quantitative ratios. These are under the numerical, and these are come under the mean plus minus S.
So if you want to compare these hemodynamic parameters in two groups, what is similar
Unpaired
for the scale? Both are ordinal. Both variables are ordinal. One is group, so dichotomous and ordinal. You have two groups है और उसमें dichotomous and ordinal variables and with UK. Sampling method कैसे करते हैं? Like patients will be coming to you, which will be for this short gynae procedure. So how will you like? You have two groups. So how you are doing?
sample size was calculated by a Chauhan O8L, which is a previous study, and from that we got a prevalence of movement in lower limbs, which is 32.5% and 10%. So the total sample size is 140 patients, which is
कैसे calculate किया?
from the prevalence.
Formula use किया? Which formula?
No, it's from the open.
Know how to get the sample size from that. Sampling method, because you have two groups. Right? So patients who are posted for short gynae procedures, and you have to either give in what proportion that you are giving these two drugs. How will you decide? Like this patient will go for this patient will go for this. Okay, but अभी जैसे आपको 140 लेने हैं, 140 में 70 is good and 140 is
67.
70 अभी एक पेशेंट आया तो लाइक इसको कौन से ग्रुप में डालना है? लाइक सपोज दिस इज ग्रुप ए, जो एक आप ये बोल रहे हो इन दैट प्रोपोर्शन 1:4 वाला एक ए ग्रुप, दूसरा बी ग्रुप है, ये पेशेंट किधर जाए?
This is we did a double-blinded study, so
डबल ब्लाइंड
So the drug was prepared by the another anesthetist who was not involved in this study.
by some lottery method or something ना कि ये A में जाएगा या B में जाएगा. Next group A.
My question is, does COVID affect overall pulmonary functions of remdesivir treated chronic smokers differently from remdesivir treated non-smokers after pandemic? My objective is to determine the effect of COVID on remdesivir treated chronic smokers pulmonary infection in comparison to remdesivir treated non-smoker pulmonary function after. People is CT score. The scale of measurement is 0.6. My sample is a cluster type. The sample and the sample size is 100.
This score generally like the ordinance
My research question is, what is the difference between risk factors in patients of acute myocardial infarction in young, middle, and elderly age group? Objective is to determine risk factors of acute myocardial infarction in different age groups, for which variables used are age, which is interval type of variable, and scale of measurement will be interview. Next variable, gender, which is nominal type of variable and measured by interview. Next variable, smoking, which is also nominal type of variable measured by interview. Next variable, alcohol, diabetes mellitus, hypertension, obesity, family history, dyslipidemia, anger issues, and psychological stress. These all variables are nominal type of variables which can be measured. So we have made categorization for young patients 18 to 39 years, middle age group 40 years to 59 years, and elderly 60 years and above. Yes. Our sampling method will be stratified. All type of risk factors, not only for acute myocardial infarction. Sampling method uses stratified random sample. Yes. Descriptive statistics for age mean and all the qualitative variables. Yes. Yes. Inferential statistical test use chi-square test. Young age, middle age. Age group and age and smoking, age and investigation. Lipid profile, HDL.
आपको देखना है कि HDL कौन से ज्यादा है, कम है, ज्यादा है तो हाउस भी ज्यादा है।
I mentioned objective is to determine the practice of
Okay. So this exercise that you have done right now, okay, right from yesterday and today, this is very important, not just for this workshop, as I told you earlier also. When you are preparing your synopsis, you have to, for your topic, you have to do all this exercise. You have to again, because you have to send one synopsis to the university, again you have to fill a separate form for the ethical committee clearance. Again that you have to write all these variables and all those things. So for your dissertation topic also, you have to do all this exercise, and this is just a practice for that, so that you get a orientation regarding how to proceed, how to prepare research question, hypothesis, objectives, and what should be the variables, dependent, independent variable, type of variable, scale of measurement, all these things you have to write. There is a table given, type of variable, type of variable, and scale of measurement. So you have to fill all these details for your dissertation. So for that, this exercise is very important. And whatever you have finalized, okay, on one page you have to write everything, right from the research question till the inferential statistics that you apply. Okay, write on a paper, and tomorrow you have to submit it to me at 9. Okay, all the groups, mention name of the group, that is group A, group B, group C, or group D, E, whatever. Okay, so moving forward, the last session for today is about ethics in medical research, and for that we have Dr. Sangeeta Patil ma'am. She is associate professor in the Department of Biochemistry. So I invite ma'am to conduct this session on ethics in medical research. Ma'am, please.
Thank you very much, sir. So, I am Dr. Sangeeta Patil, Associate Professor from the Department of Biochemistry. Now, I am going to tell about the ethics in medical research. Okay. So, do you know about the ethics? Anybody know about ethics? Okay. As you have taken the admission for the PG, so you have to do the research project. So already selected or not? Project topic you decided or not? किया या नहीं? Decided किया है ना? Okay. So are you thinking regarding the ethics? कभी सुना है ethics के बारे में? Okay. Listen about the ethics. Anybody know about? You just tell me just in simple word what is ethics? Okay, you just tell me the ethics in routine life. Okay, set of the principles we should follow during the research. That is means the ethics in the research. Okay, so move to the today's objective of today's topic. So at the end of the presentation, the participants should be able to explain what is ethics, describe important historical events related to the ethics in research, describe these and list the important documents that describe the various guidelines related to the ethics in medical research, and describe the informed consent. Last, that is describe the institutional ethical committees. So the objective related to the ethics guidelines as well as informed consents and institutional ethical committees. Okay. So let's see the start from the introductory part. So what is the biomedical research? What is its essential? It is essential for the development of better intervention to prevent and treat the illness. Okay. So research is nothing but the process of investigation leading to the new insights effectively shared. Okay. That is after completion of the research. It is very important to why you are doing the research. Now it is what is its important? Important. Sharing is important, which apply application of the research. Okay. So research ethics deals with the analysis of ethical issues that are raised when pupils are involved in participate in research. So word ethics means what? The simple meaning of the word ethics, that is the moral philosophy or the moral principles. Okay? Ethics means the principles. Okay? So ethics in medical practice means the moral principles observed while doing the medical practice, and ethics in the medical research means the principle that we should follow and during undertaking the medical research. Okay? So in simple words, it is the guiding principles during the research. Okay? Now, what are the objective of the research ethics? Okay? So there are three main objective of the research ethics. That is, first, to protect the human participants. The participants which are these human which are participants in the our research. Okay? Then serves the interest of the individual, groups or society. So interest for the participation is very important. Okay? And to examine the specific research activities for their ethical soundness, looking issues such as management of the risk, protection of confidentiality, because it is very important, protection of the is any record related to participants confidentiality. This word is very important during the research. You should keep the all data confidential. Okay? And the process of the informed consent. Okay? Now, before starting the history of these related to the medical research, ethics related to medical research, do you know about the history? Listen, any tragedy or anything happened? Do you know about that? Suna hai? History, any history related to the ethics? Okay. So there are why there is a need to put this such a guidelines? Why? Okay. There is a big question why there is need to follow the guidelines. Okay, because there are behind that there is a history. Okay, let's see what is that history. Okay? So this history of the medical research, that is in ethical that is practice while undertaking medical experiment or research, has its origin during the Second World War. Okay, so what happened in the Second World War? Okay, so German doctors conducted a shocking experiments. Okay, on prisoners of the Second World War. These experiments were done by the doctors on various diseases like malaria, drugs, sulfanilamide, seawater, sterilization, poisons, bone muscle, nerve regeneration, jaundice, and what they did during that time. Okay? So this nothing that is doctors, that is a Nazi physicians and their assistants forced these prisoners for participating their research. Okay? And during that time, no consent was given for that procedure. Then typically the experiment which did during that time, the results mostly occurred like death, trauma, and permanently disability. Okay? So what they did during that time, they took the photographs, anthropometric measurements, they killed the prisoners and skeletons were used for the anatomical research. Okay? And half body keep in ice or half body keep in boiling water bath, and again they studied on the neurological aspects. Okay? So what happened? What is your opinion about these Nazi experiments? It was good or bad? What is your opinion? It is okay. So this research was conducted without consent of the participants. That is means participants that is not a single, they didn't know any idea about that during that time, caused unnecessary pain, suffering, and death also occurred during that time. Absence of the benefits for the participants, they haven't got any benefits during that experiments also, and lack of adequate scientific rationale. Okay? So these are the drawbacks of these Nazi experiment or characteristics. So see, this is the picture showing some experiments during these 1942 to 1946, these Nazi experiments. Then, meanwhile, what happened in 1947? The Nuremberg Code formulated some guidelines. Okay? So this is what this document. Okay? According to this Nuremberg Code, the voluntary participation and informed consent of the human subject is absolutely essential. That the benefit of the research should be outweigh of the risk. Okay? And there should not be unnecessary physical and mental trauma to the patient, and animal experiments should precede human experiment. That is means first you the experiment do on the animal and then you proceed to the human. Okay? And experiments that are likely to result in death and disability in the patient should never be conducted. Such a experiment you should not conduct it on the patient. Okay? But what happened in 1947? There is a no any force of the law. Okay? So not followed. The researcher during that time they not followed all these Nuremberg Code, okay, or guideline. There is a no force of the law. Then meanwhile, the 1915 again in Europe, this thalidomide tragedy occurred. So what happened in this tragedy? Here, this is the one of the darkest episode in this pharmaceutical research history, as the thousands of the children were born with the birth defects. So what happened during that research? The physicians given to these mostly use the mothers taking this thalidomide drugs to the mother. Okay, for what? Sickness due this morning sickness, for prevention of the morning sickness. And so what happened? Those mothers which were this taken these drugs, what happened? The children were born with birth defects. Okay, so these are the some pictures showing the birth defects, like the reduction of the limb deformities. Okay? So after this tragedy, 1962, the FDA acts formulated drugs companies should be obtained the Food and Drugs Authority permissions. It is compulsory after this tragedy from the 1962. Then another also there was one study, that is Tuskegee syphilis study. I think you listen about that. It is related to this penicillin drugs, which is the this most important drugs which is used as a treatment but not used during that time. Okay? So Tuskegee syphilis experiment is also carried in 1932 to 1970, okay? And by the US Public Health Service. Here 400 Afro-Americans male infected by the syphilis were monitored. Only monitoring is there. Okay, not given as the treatment is available, but not given to the such a patient. Okay? The researcher never obtained informed consent from the men or never told the men with the syphilis. Okay? So during that time, the penicillin was the best drugs, well-known drugs for the treatment of the syphilis, but not given to the patient. And that is not offer standard treatment without their consent. And so many patients died during that time. So this is also one of the tragedy. Okay? Or one of the classical examples which should not follow the ethics. Okay? Now, so far as by this history, now the various guidelines are available, and mostly the ICMR guidelines we all are follows during the medical research. Okay? So what are that various guidelines? First, already told to you, that is the Nuremberg Code. Then Helsinki Declaration is one of the guidelines. International Conference of Harmonization Guidelines, Good Clinical Practice Guidelines, and ICMR guidelines of this biomedical research on the human subject. Okay? So just see the overview idea about all the guidelines. These first, that is the Declaration of the Helsinki. Okay? This World Medical Association in the Helsinki first decided and declared the principles or guidelines for the research. Okay? So Declaration of this Helsinki is nothing but the set of the ethical guidelines or the principles regarding the human experiment. Okay? And it is mostly in the 18th century. Okay? It is mostly in the 18th, put forth in the 18th century. It is widely that is regarded as a cornerstone document of the human research ethics, and lastly revised in 2013. Okay. Then afterwards, what is the points related to this declaration of the Helsinki? The research with the human should be based on the results from the laboratory and animal experimentation first. Then research protocols should be reviewed by an independent committee prior to the initiation. That is, before starting the research, you should take the permission or the research committee reviewed all these topics. Okay? Then informed consent from the research participants is necessary, and research should be conducted by the individual which is conducted the research. It mostly qualified. Okay? So qualified person should conduct the research. Okay? And another, when we consider the risk and the benefits, always there is a less harmful or less risk than more benefits or exceed benefits. So these are the main guidelines related to this Helsinki Declaration. Then ICH guidelines, that is International Conference of the Harmonization, is the committee which provides the pharmaceutical stability and guidelines for the industries. It is mostly related, these guidelines are related to the industries. Okay? So this, it reduces the, in the industry, what happened, any drugs when we come in the market, first do the number of the experiment, or this to avoid this duplicate testing, to avoid the duplicate testing, this ICH reduces the need for duplicate testing and lays the few basic technical guidelines for help of the pharmaceutical industries throughout the world. And it is mostly based on the quality, efficacy, and safety. Then good clinical practice guidelines. Here, this is also nothing but the one of the set of the biomedical studies, and it involves mostly the design, conduct, termination, audit, analysis, reporting, documentation of the studies, involving mostly related to the human subject. Okay. Now, third guideline, that is the Belmont report. In 1974, this National Research Act passed in this US Assembly. This report is called as the Belmont report. And according to this commission, it is mostly focused on the protection of the human subject during the biomedical research. Okay? And that draft gave the name, that is the Belmont report. Okay? So this Belmont report, again based on the three basic principles, that is respect of the persons, then beneficiency, that is means how much beneficial for the participants, and justice. Okay. So respect of the person means what? Okay. All individuals must be treated as an autonomous agent. They should be given an opportunity to choose what shall or what shall not happen to them, and the consent of the patient is research study is the must. Okay. This is, that is means the respect of the person. Then beneficial, that is always it is a beneficial, that is there is a less harmful and more beneficial. The research must maximum benefits and minimum harmful. So for before starting your research, you also just see what is the what are the various benefits of the research, and first you measure the benefits, then you also measure the harmful that effects, and then you consider which research you should start. Okay, so first measure the risk and benefits, and then undertake such a research where minimum risk or more benefits. So it is very important. Then justice. This is also third aspect related to Belmont's report. These benefits of the research must be distributed fairly and must reach all, that is the benefits of the research, that is sometimes only reach up to only the rich persons. So it should reach to all, rich as well as poor person. Along with these guidelines, there are so many other guidelines, like the Council of International Organization put some guidelines, as well as UNESCO also put some guidelines related to genome and gene data. In 2006, the ICMR also put some ethical guidelines for the research on the human bioethics. Okay? And you should know all these guidelines. These guidelines also display on their website also. Okay? So that is the ICMR guidelines. Every student, PG student should know which guideline you should follow. Okay? So now we'll see detail about the ICMR guidelines. So what is the IC? What are the main ICMR codes? Okay? Research should be directed towards the increase of the knowledge about the human condition in relation to its social and natural environment. It is betterment for the all. Okay? Research should mostly increase the knowledge. Okay? By this research, you should increase the knowledge, okay, about the human condition. Then no person become a mere participant is placed at no greater risk is there. Then there should be total preservation of human dignity when undertaking the research. They should be transparent. Okay? Research should be transparent. The research should subjected for evaluation, reviewed by the institutional ethical committee. So in our institute, we have institutional ethical committee or not? Do you know? Have or not? In this institute? Yes, we have the institutional ethical committee. Three main ethical principles: voluntary informed consent, right to draw from the study, and right to have offer standard treatment. This should follow as per ICMR codes. Okay. Now, what are the ICMR guidelines as related to this biomedical research? So this ICMR has laid down the ethical guidelines for the biomedical research on human subject in 2000 and then revised in 2017. Okay. These guidelines are applicable to all these biomedical, social and behavior science research for health conducted in India involving human participants with their biological material. Okay. And all these guidelines already told to you, these all are available on the ICMR website. Okay. So also you just take a printout, read all the guidelines in detail. Okay. So just I will give some idea about the guideline. Okay. So the first, let's see the essentiality. Use of human participants is considered to be absolutely essential. Research should provide knowledge and benefits. Okay. It should be essential. Research should be essential. Provide the knowledge and benefits. Then when we consider the voluntaries, informed consent and these community agreements, the participants retain the rights to abstain for the further participation. Informed consent also shall apply for whole community or each member of the community. Then next, that is a remuneration if required, the research participants for their involvement also give. Then privacy and confidentiality, identity and the records of the human participants of the research are kept confidential. Do you know about that? The patient which you are going to take for your study, the patient's name, all these patient's history, you have to keep. आपको क्या करना है? Confidential रखना है. Okay? Not exposed. Okay? So precaution and risk of the minimization, care and precaution. You should take the care and precaution of all the participants in all stages of the research. Okay. Then research is conducted by the competent or qualified persons who act with total integrity and fairness. The person who are going to do the research, this must be a qualified. Okay. So then research should be a fair, honest, transparent manner. Then these already told to you, the research mostly having the more benefits, okay, than the risk. Okay, more benefits are there. Then the procedure required for the research or all institutional agreements made in respective manner. That is first, that is you take the, that is first the research reviewed by the committee, then take the permission. There is a specific the procedure for that, that is institutional agreement. Okay. Then next, public domain. So this is also very important. So I think you also in your that is rules for that, there is a publication must for PG student, na? Must or not? Yes. So that is means the public domain. Research are brought into the public domain through scientific and other publication source. That is means this is also one of the ethical guidelines. Okay, and so your research that is published, okay, in a society, and they can use the knowledge. Okay, then responsibility completely resolve the questions related to the research by directly or indirectly through the researcher or funding agency or institution. That is means suppose you have any problem relating the research, you should solve it not only you yourself, you also take the help of your guide as well as the another researcher as well as any funding agencies as well as institution. Even there is a committee, you take the, like here, which committee is there here? Research committee. Okay, so you have to take the help from the research committee. Okay. Then direction and guidelines prescribed for the research are observed and complied by all the persons connected with the research. Okay. So because of that, you should know all the guidelines which is available on ICMR website. Okay. Then let's see, do you know about the informed consent? देखा है आपने? Have you seen which type of the informed consent? Anybody know? You just tell me the answer. Informed consent. Which type of the informed consent is there? It is any document, it is anything, or what is the informed consent? It is a form or document. Okay. So do you know about which type of this informed consent? The participant should be able to read or understand. Okay. That is means the language of the informed consent form is mostly the language which is similar to the language of that participants. Okay. So now let's see. So you should know the informed consent also. So today just I will give the idea about the informed consent because it is also this is the part, it is very important. Okay. Everybody know about the informed consent form, then you fill up all these during your research and keep in your record. Okay. It is very important, informed consent. Okay. So let's see what is informed consent or what is informed consent form. Okay. In modern ethical conception, all research conducted on the humans must be is early accepted by the subject themselves through the procedure, and that procedure is called as a informed consent. See, the research conducted on the human must be early accepted by the subject themselves through the proper procedure, that is called as a informed consent. Okay. It is a process by which a subject voluntarily confirms his or her willingness for particular trial after having been informed of all aspects related to trial or related to research, okay, to the subject. That is all the aspects related to your research, trial, anybody related to all the aspects, you should explain to the subject or participants. Okay. So, and documented by means written, signed and dated informed consent. So on the informed consent, there is a sign also, name and all these, in short, all these information which is this written, that is your topic's name, research topic names, okay, in the subject's language and signed and dated with, and that is called as a consent form. Okay. And this form must be written in a language which is easily understood by the subject. That is, subject can easily understood the informed consent form. Okay. So maybe Hindi or maybe Marathi. Here you need which type of the informed consent form in Maharashtra? Marathi, not English, not understand by every patient or every subject. Okay. So there is need. Informed consent must in which language? Marathi. Okay. So the process of the informed consent, the first provide the information to the subject or information given by the researcher or physicians with appropriate scientific training. Okay. So what are that information which you should provide to the subject? First, information about the health condition. Then mostly you should know the purpose, and you have to tell them regarding the purpose or this nature of the study. Then also very important, that is the duration, the expected duration of the subject participation. You should tell to the subject or the participants. Okay. Then detail about the intervention. If intervention is there, so you should explain the intervention to the subject also. You should explain the probable risk and benefits also, and possible outcome if the condition is left untreated. This is also very important. If there is any condition which is not untreated, that is not treated, that is untreated, you have to also explain such a untreated condition. Okay. And duration of the storage of the proposed data. Okay. And you surely told, that is you have to tell them to the how much duration you should store this data or record of that particular participants. Okay. So this is about the mostly the various that is points related to the research which should you follow and you should explain to the participants. Then what are the elements of this informed consent? There are three main elements, that is competent, then knowing and voluntary. Okay. So let's see first, that is what is the competence to consent involves. The person has capacity to make a choice about this proposed course of action, know about the risk, benefits and alternatives, and understand the consent. All these are voluntary. Then knowing, informed consent should be a knowing, that is number of the evidences shows that participants often fail to understand much of the information which is provided in the consent, so because of the lack of awareness. So knowing is very important. Okay. And then free and voluntary, the consent may not be induced by the fear or force. You cannot force to the participants. Okay. So it is also very important. Then assessment of the ethics of the research. So research which involve the healthy voluntaries or patients must be subject to independent ethical review, and that should be conducted by the research ethical committee. Okay. Already we have seen about the informed consent. Now the how your research is reviewed by by which committee, what is the detail about that committee. Okay. So you should know about that also. So just let's see about this ethical committee about this research. Every institution plan to undertake the medical or this health science related research must have independent ethics or ethical committee or institutional review board as per ICMR guidelines. Okay. We have also such a committee. So this committee is made by the various members. So let's see which members is there. The members this committee should have the members who have the qualification, and that is they must be qualified and experienced to review the ethical aspects of the proposed trials, to the review the science or research in it, and to review the medical aspect in the research. Okay. That is science and medical aspect can review easily. Okay. Such a members mostly included in this committee. Okay. Then this institutional ethical committee mostly at least there are 5 members, at least 5 members. More than that it is better, but at least 5 members is there. Chairman should be from outside the institution as far possible. If there is a possible, you take the chairman from the outside of the institution. Then member secretary should be from the same institution. Okay. Member secretary of the committee should be same of the institute. Then if you consider the overall members, one, there is a chairperson, 1 or 2 persons which having the medical sciences, that is pharmacology subject, then 1 or 2 clinicians from various departments or institutes, 1 legal experts or a retired judge also required in this committee, one social scientist. Okay? You should know the members also. Okay? One scientist is there, one philosophers or ethicist also included in the committee, one person from the committee or member secretary. So by these various members, the ethical, this committee mostly made. So what is the main function of this committee? Okay. So main function of this committee, that is protect well-being, safety, dignity and right of the potential research participants. Okay. All these are mostly related to the participants. So this is also related to the protection of the participants. Protection of the participants. Then to ensure that the universal ethical values and international scientific standards are expressed in terms of local community values and customs, that is they can easily understand. Okay. Then to assist in the development and education of research community responsive to the local healthcare requirement. Okay. So local healthcare requirement. So develop and education of the research committee is mostly responsive for that, okay, local healthcare requirements. So this is about the institutional committee. Okay, do you understand institutional ethical committee? Okay. It is made by the various members. Okay, at least how many members are there? 5 members. Okay. So let's see the next point related to this research. Ethics required for the selection of the research participants. This is also very important and you should know what are the ethics you should follow during the selection of the participants. So first, so mostly always you selected what? Tumcha research, your research is always, it is related to the patient or what? Patient. You tell me this nature of the participants for your research. First group, patient. Okay, your only patient is there. Healthy volunteers also you can take for the research. Only patient, healthy volunteers, any other. In patient, there are other patient, that is means what? Only disease, suffering from any disease, individual suffering from any disease or related. Okay. Like you can pediatric, where is in pediatric? In pediatric, we can take the children's. Okay. You already selected your research topic? Not? Why? You nahi liya? So, okay, you tell me your planning in pediatric. कुछ मैं ये करने वाली हूँ, देखो आप कुछ भी करो लेकिन मैं तो यही करने वाली हूँ, ऐसा कुछ तो. Birth? What? Okay. So what type of the children is there? Okay. Okay. So according to your opinion, is there any harmful to these babies? Okay. So as per your opinion, institutional, that is ethical committee, which we have, suddenly give the permission to you? Yes. And you have to put all these questions, the questions which is raised by this institutional committee related to this subject. I know all the idea regarding to your subject, but that committee also have, and you already during that time you have to submit your synopsis also there. And the institutional, that review committee did all these things, and any ethics related to that topic, they will raise the questions and you have to give the answer. Okay. So such a various participants are there. Okay. Like children, healthy volunteers, pregnant women, gynec का कौन है यहाँ पे? And what is your subject? Iska. हाँ, your. पता नहीं, बोलो ना फिर. नहीं, कौन से सब्जेक्ट में पीजी कर रहे हो? You are doing PG in medicine. Okay, sit down. So in medicine, there are also various participants. Okay? So let's see. So which type of the participants you have to select it in your research and which care you should take. Okay. So let's see. First, if you want to select the healthy voluntaries. So mostly not suffer for these any illness relevant to the proposed study or able to understand give valid consent. Okay. Then listen. Then pregnant women should be avoided if not necessary or select in such a research where minimal risk to the fetus. So research should be such a type of where there is a minimum risk to the fetus. Okay? Such a type of the research you should take during this when you want to do the research on the pregnant woman. Okay? So because there is also one act, that is Medical Termination of the Pregnancy Act or Prenatal Diagnostic Technique Act. Okay? Which is mostly for basic, it is proper for this prenatal diagnostic research and research related to the termination of the pregnancy we should follow. Okay. Then what about the children? The research on the healthy children should be approved when there is a minimal risk. Okay. Research that equally informative is carried out on adult should never be done on these children. Okay. That is not you cannot use the children, such a type of the research. Okay. On the this research which is you can carry on adult, so you can carry on adult by using the adult participants. Don't use the children for that. The any that such a research which there is only need the children, then you can take the children and risk also minimum. Then prisoners, in some research prisoners also take. So under the safety condition and you should follow all the guidelines, you can take the prisoners. Ethical committee especially pay attention on that. Okay, so if you want to take the prisoners, it is also very important. You should follow the guidelines. Then the subject which having the physically and emotionally harmful, okay, disabled individuals selected for the research is selected in such a way that there is a burden, that is way that burden and benefits are equally distributed. Okay? Content, language, procedure used to obtain informed consent, everything you should follow during that time. Okay? Then patient. So now everybody, mostly the participants, that's all research is mostly patients is used as a participants for the research in the medical research. So for that, from the when you take the this patient from this population, general population having known or this the suspected abnormalities, that is diagnosed patient. Okay, controlled participants suffering from a disease which is not a subject of a study. Okay, so you cannot take the controls. And another very important thing, that is the patient which maybe, that is the patient these participants is this willingness is very important for that, okay, in the your research. So maybe willingly participates in the research, and research might be therapeutic benefits to the patient. If you want to take the patient, it must be beneficial to the patient. So this is about the participants of the research. Now overall these from this point, that is participants of the research, this topic is over. So which points which is related to this topic, ethics in medical research, is very important. Let's see. The research participants, okay, which is not subjected to the harm. Okay, you first take the care. Then respect is very important. Respect for dignity of the research participants. So should give the respect. Then another important thing related to the ethics in the medical research, that is you should obtain the full consent form. Okay, full consent. Then protection of the privacy of the research, this participant, that is confidentiality is very important related to the participants as well as the data which is obtained from the study. Okay. Then source of the funding, conflict of the interest have to be declared. Declaration is very important. Then communication related to the research should be honest and transparency, or bias in the this representation of the primary data should be avoided. You should avoid the bias related to the representation of the data. Okay? So this is about the main that is important principles. In short, just I am giving here, and you should know about that. Participation, there is no any harm. Then you should respect the to the research participants, obtain full consent form. Protection, confidentiality is very important. Okay, and declaration if there is any the funding agencies. If you want to take the help for the funding agency, you should declare it. Okay, so this is about the important principles of the ethical ethics or principles in a medical research. Okay, thank you very much.
Thank you, madam, for summarizing the historical aspect of how ethics evolve in the research. Though at glance it looks very boring for you, but you have to follow all these guidelines while preparing your synopsis and while giving your presentation in front of ethical committee. Okay, and even after passing out your MD, you have to follow all these guidelines in your practice also. Otherwise, you will end up in CPA. Okay. Okay. Thank you. Today we are done for the day. Okay. So I have sent a feedback link. So you please all fill the feedback link, then go. Okay. And one more important thing, tomorrow is the last day. And at the end of invalidity function, you have to give a feedback. So among yourself, volunteer, one girl and one boy, you have to give a feedback about the 3-day session. How do you feel? What you are expecting from us? What things your suggestion to improvise the this 3-day session. Okay. Niyati has already agreed to give his feedback. One from boy. You decide and please. Come topper. Fateh. Okay. Thank you very much. Okay. Feedback form भर दो or you can go. Okay. Thank you. और कल टाइम पे आ जाना सबने. आज जल्दी छोड़ रहे तो आज 1 घंटा पहले छोड़ रहे तो कल आज नहीं जाने का अभी. अरे मुझे तो जाने का ना क्लोज करके तुम्हारे लिए रुकूंगी अभी मैं. पहले फीडबैक फॉर्म तो भर दो पहले.